We've been doing a week-long series centered around African American health in collaboration with Moffitt Cancer Center, along with the USF Black alumni. And so today we're going to have a great conversation with some great panelists. So first off, I'm going to introduce to you Dr. Brandon Blue, who specializes in bone and marrow transplants at Moffitt Cancer Center. Also, Dr. Yvette Henderson Jackson, who specializes in cancer diagnosis at Moffitt Cancer Center. And then finally, our panelist, Dr. Michael McPherson, who is a chiropractor with functional health of the body and an emphasis on joint functions, motion, and health. So we're going to jump right into the questions. If you have any questions, please be sure to use our chat. We want this to be a great conversation piece. And so please don't hesitate to answer any questions. There's no questions that aren't embarrassing. This is a great opportunity to get this free advice while you're here, because a lot of us don't really get the advice because we don't go to the doctors like we should. So please take advantage of this opportunity and get this advice that you have. Look, there's no copay for this, so welcome. All right, so before we go any further into our presentation, I think I could not move forward without asking, because we are in what we call a double pandemic, where we are seeing the COVID-19 happening which are really affecting African Americans. And then we're also having social injustices, which we're also seeing as well, where we're seeing African American men and women who have been targets out there as well for whether it's for this police brutality or other things that are happening. But we are seeing this, and I don't want to bring a group of people like this in the room, because I think we go into rooms enough and don't have these conversations. So I first off want to bring you all into this conversation and just ask, how are you dealing, being a Black professional, how are you dealing in this climate? And we'll start with Dr. Henderson Jackson, then we'll move to Dr. McPherson, who is also a business owner. So also talk about how are you dealing with being a business owner in this climate as well. And then finally, we'll close out with Dr. Blue. Let's just do a check-in. Oh, Dr. Henderson, there's no sound, Dr. Henderson. All right, no worries. While we wait for the sound to kick in for Dr. Henderson Jackson, we'll jump over to Dr. McPherson.
All right, good afternoon, everyone. Thanks, Ashante, for that question. It's definitely been an interesting year for all of us. I think we were all making the best of it each and every day. My perspective involves, like you said, being a business owner as well as a practitioner. First, to speak to the business owner aspect, I mean, as a business owner, you never really know what each day is going to hold. You just prepare and kind of, take it as it comes to you. But with this climate, I'm in South St. Petersburg, a very diverse area. From a socioeconomic standpoint, just in many aspects, it's very diverse. And so we actually did slow down initially when everyone was asked to kind of close their doors. And as we opened back up, we actually got really busy again quite quickly. And then we also implemented a lot of the safety precautions, obviously, that we were asked to implement. And our patients just felt comfortable coming in to see us. We really got busy right after we opened up. And I think a lot of that's due to just the increase in stress. A lot of people were stressed in many ways, physically, emotionally, mentally, and that tends to manifest in the body in different ways. And so people came in to the practice, both old and new patients, and that was refreshing to see. As a Black practitioner, again, I mean, there are things that in our practice, I think it's more unique than most medical practices in that we spend a lot of time with our patients. I mean, our average visit is probably 10 to 20 minutes. And so we're talking about a lot of things, and we see our patient regularly as well. So we're talking about some of these social injustices that you were speaking of. And these topics do come up. And like you said, I think it's a good opportunity for us to remain professional, but still have these discussions with people who may not look like us, and even those who do. And for me, it's been good to see that people are at least open to the discussions. And for me, I very much bring up certain things that, some people may not be comfortable bringing up, but it's always from a position of respect. And I think the patients appreciate that. And we keep it very professional. And it's important to talk about these things, though.
All right, thank you so much. Let's go back to Dr. Henderson Jackson.
Hi, can you hear me now?
Yes, we can.
Thank you. So as a physician, as well as a mother with 2 young children, it has been difficult during this time trying to explain to a 7-year-old and 5-year-old what is going on between pandemic, they having to wear masks, they cannot be able to be with friends, versus other things they may see on the news with the violence or the protesting, where they may ask, what does that mean? What's kind of going on? So then I have to have those type of conversations with my children. At work, I feel as a pathologist, I work predominantly in the laboratory. So it is not as, should I say, blatant with any type of discrimination stuff that I will encounter, different when I was in high school, college, and stuff in different areas in the United States. But you can feel there is intensity around people are trying to be very cautious in the words that they use. I notice around me than usual when I hang out with these same people. I think with all this information and all these things that are going on, they're a little bit more conscious or trying to be careful with what they say or say to you or how they act or explain things. But I think, again, this is a time where we're going to see a lot of challenges. But I think as human beings and part of the United States of America, I think we can work through these problems. We have come so far from a lot of things in our history. I hope that we can do better and not fall backwards or repeat things. That was not good for us. So I think we will get through this.
All right, thank you so much for that insight. And then finally, Dr. Blue.
So, really for me, I'm from this area. I grew up in the south side of St. Pete. So Dr. McPherson, I know exactly where you're referring to. I actually went to school at Lakewood High School and, really grew up on, so this is my community. I'm here, at Moffitt as a cancer doctor, and really with things happening with COVID, it kind of scares me, man, because you already take a group of people who are kind of not really connected to the healthcare system, and you tell them, hey, this virus is really going to hurt you more than anybody else. And so things that I'm really appreciative of us having this opportunity to talk today, because we need to talk about getting in for screenings, things like prostate cancer and all those kind of things that, if they're telling you don't go outside, people are not getting their prostate exam checked and those sort of things. Women aren't getting their mammograms done, things that could potentially save their life. They're now pushing back what could have been done in 2020. Hopefully people getting it done in 2021, but still, Black folks, so a lot of times we wait, we say, we're gonna let somebody else try it first. You know what I mean? And we really not gonna be the ones to be jumping out there, in the front lines to try to, get our mammograms or colonoscopies or those things that could be life-saving. So I think for us, honestly, I think we need to have this conversation, which I'm sure we'll get to more in the discussion today, but really this COVID thing is really kind of turned our world upside down, and our people are dying and will potentially die for things that could have been prevented or found in 2020, and we won't know the results of that until years down the road. So that's my thoughts.
All right, I do thank you, appreciate it. And since we're with you, Dr. Blue, we're going to go ahead and move forward with your presentation. I do know you have a presentation, so we're going to move forward with it. As always, this is a conversation, so we're looking to have some great dialogue. So if you see something in the slides, put it in the chat. We'll definitely stop the presentation so you can get that clarity. There may be questions I don't understand as well, so I may just stop you as well, Dr. Blue. So if we can, let's go ahead and get with your presentation, which is entitled Disparities in Cancer, Men's Health.
All right, so I appreciate you guys giving me the opportunity to talk. We'll just move to the next slide so we can get things going in the sake of time. So what we'll talk about today is really some of the main issues that are related to men, okay? And like I said, since I am a cancer doctor, I wanna make sure that we at least bring up some of these cancer-related issues, okay? The first thing to know is that unfortunately, as Black men, we get prostate cancer and die from prostate cancer at a higher rate than other folks, okay? And so we're half as much likely to develop it and actually twice as likely to die. So what that means is that, you might hear in other circles that prostate cancer is not that bad or it's not that big of a deal. they're not referring to you, okay? Because really, as far as a Black man's disease, prostate cancer is taking our lives, okay? So that brings me to point number 2 is that you as Black men, if you're on the call or if you have a loved one who's a Black male, they should be screened for prostate cancer, okay? So several years ago, there was a big divide in the United States of America saying that we shouldn't screen, we should screen, and some doctors are saying, prostate cancer, what's the harm? There's no big deal. I'm not even gonna screen my patients. Meaning, and you say, what does that even mean, screening the patients? What that means is there's a test called a PSA, all right? I put it in kind of capital letters there on the screen so you can see that. Those 3 letters can detect if there's early signs of prostate cancer, okay? And so what should happen is that every man, okay, and every Black man, all right, really, once you get over the age of about 45, you should be asking your doctor, hey, can I get a PSA, okay? And they may say, oh, no, I think that there's no utility in that, or there's no problem. And you say, no, 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 I know that as a Black male, my risk and chance of getting this is much higher, okay? So if they say, no, you might need to push back on that and say, I think this is an important test, okay? You say, well, how's the test given? It's actually a blood test, okay? So you would go to like Quest or LabCorp or one of these places, get a blood test, and they'll check to make sure if you have early signs of prostate cancer, okay? The second point is that kind of already talked about is that, like I said, you may hear this, and I put it in quotes, let's wait and see. All right, if you hear those words in relation to prostate cancer, and you happen to be a Black male, or you happen to, have a loved one who's a Black male, and they said their doctor told them that, that does not account for Black folks. Okay, so that wait and see is for other populations of people. But as a Black male, you don't want your doctor to say wait and see, all right? So don't be fooled or scammed if you hear that, and you need to inform the doctor that really as Black men, that doesn't refer to us, okay? And the last point on prostate cancer is, it's not enough of us men who are, enrolled in what we call clinical trials, all right? So let's just say that you unfortunately do have prostate cancer, okay? It's not the end of the world, but what you want to do is make sure you also get treatment, okay? One thing as people of color, that sometimes we are a little bit late to accept kind of the diagnosis. So you might say, well, I'm not claiming that. It's kind of a typical thing that I hear. And so you want to make sure that if someone tells you that you have any type of cancer, but specifically prostate cancer, you want to make sure that you come get treatment. We have treatment here at Moffitt Cancer Center, but really wherever you can get in, make sure somebody's seeing you. And if they have the opportunity to enroll you in what they call a clinical trial, then we should do that. You are not a guinea pig. You're only making things better for your sons and your grandsons, because what we don't know is that the treatment for some cancers and diseases are different in certain populations. So do Black people respond the same to this drug versus white people? We don't know that unless you are enrolled in this research. So that's a big thing that I wanted to just bring up today.
All right, before we move on from this slide, a couple of questions. Can you break down the acronym PSA and what PSA means?
Yeah.
And then another question came in is also, can the PSA create a false positive?
Yeah, so basically the PSA is the prostate specific antigen. And so that's what those letters stand for, okay? Prostate specific antigen. What that means is it's a prostate specific test, okay? So that kind of brings up the second question is, can it kind of be elevated for no reason or for reasons unrelated to cancer, okay? So because it's a prostate specific test, any kind of things that are related to the prostate, it raises that number, okay? So of course, cancer is the big thing that can raise that number. So because that is kind of the most common reason, of course, we want to check to make sure. But however, some people have an enlarged prostate, meaning that it's not cancerous, but it's actually enlarged. So sometimes that can actually change the levels of the test, okay? Also, there's certain things that you can do in your day-to-day as far as like urinating and some of those kind of things and sexual activity that can actually change that PSA number. However, you won't know that it's high until you get it checked, you know? So the first step is let's get it checked, all right? If it is high, all right, then let's talk about what are the reasons, because cancer is number 1, 2, and 3, and it has to be kind of, especially if you're a Black male, because like I said, it's so serious in our community.
Thank you.
We can move on to the next slide. All right, so this is a big one. All right, so colon cancer. All right, so I'm sure we all have heard about Chadwick Boseman and the guy who was in Wakanda Forever, Black Panther. Okay, so really, this is what he died from. So this is one of those things that doesn't matter if you're a multimillionaire like Chadwick or if you are, unemployed. You know, this is really something that affects everyone. Okay, and so as Black men, as similarly to prostate cancer, you should know that the age that we get diagnosed with this type of cancer is earlier than other populations. Okay, you say, well, does that matter? And the reason why it matters is that not only is the age the difference, but the how advanced or how much burden of the cancer that we have in our body is higher compared to other populations. And even when we get treated, we still unfortunately have a worse survival, meaning that we don't live as long, even if we get treatment. So those 1, 2, and 3 reasons should be kind of at the front of everybody's mind, especially if you have a Black man or you care about a Black man. You should really just let them know that, hey, colon cancer is really one of the big problems that is taking people out even younger. Okay, like I said, very similar to Chadwick Boseman. She said, well, what can I do? All right, you can't change your DNA, you can't change your mama, your daddy, your grandma, right? That's just what you're born with, okay? But what you can do is you can talk to your family, meaning that, you know, you might ask, well, why did granddaddy die at 45? Your mama say, well, you know, I don't know, you know, and sometimes we don't know, right? But if you know you have an issue or granddaddy really had cancer, you need to talk about it. And we don't talk about it enough in our community. We try to keep stuff bottled up, saying that we don't want to worry somebody, or, you know, it's not their problem and I don't want to bother them. But this can affect your son, your grandson, your nephew, right? So that's the biggest problem, because what us as doctors can do is, if you tell us certain things about your family history, then you can basically help us predict your chances. And so you say, this is a big thing too. People say, well, you know, and even for myself, you know, I don't really talk to my dad like that. My dad really wasn't a part of my life growing up, you know? So I tell you what thing I do know, has he had a colonoscopy? I do know that, right? And I know that, you know, so I think that even if, you know, your dad isn't a part of your life, because that's my story, you know, I think there's some small things that we can know. If he doesn't know, I bet you have a way of contacting his mom or his sister or someone in his life to say, you know, I know, you know, my dad hadn't been around, but, you know, ask his sister, ask his mom, does he have cancer? Does he have colon cancer? And if he's not getting checked, this is a big thing to talk about, because it can affect you and your kids.
Exactly.
Yep.
Now, in regards to getting tested, generally, what age would you recommend for a male to start getting screened?
Yeah, so typically, everyone in America, it's been approved by every insurance company, where you go, 50 is the age, okay? However, in Black males, really starting at about 45, you want to start to have those conversations, okay? So if you're a 45-year-old Black male, and let's just say you don't know your family history, I would say you're probably one of the ones who may want to get it even a couple years earlier, right? Like you want to get it more of the 45, 46 age range, because you don't know, and meaning that it could be there, but you just hadn't had those type of conversations. So really, 50 is a blanket statement, but really, as far as Black males, really around 45, we should start to have those conversations.
Perfect. Thank you.
Yeah. Other things, just to kind of round it out, obesity, what we put in our bodies, is super important. We know that fatty foods and, you know, going to, you know, getting fried chicken and Popeyes and that kind of stuff is really going to add up, and it actually causes colon cancer. So, so just know, I know everybody liked those Popeye sandwiches, and when they came out, the line.
Wait, Dr. Blue. Wait, Dr. Blue. You saying Popeye's chicken
Popeye's chicken,
is
man,
a fact?
it's
So
killing.
that whole line that was lined up, and when Popeye's chicken first dropped that sandwich,
they should have been doing colonoscopies, you know what I mean? Because really, it can lead to a problem. Okay, so that, as well as smoking. So this is something they don't talk about. People always hear smoking lung cancer, but no, smoking and colon cancer is a problem. All right. And so if you're smoking, and typically when we say smoking, we mean cigarettes, just so people know. But when you're smoking cigarettes and tobacco related products, really that stuff, when it gets in your colon, causes cancer. And the last one, of course, we say exercise. So you say, well, what does exercise mean? Typically, we say people, if they can get at least 30 minutes of exercise a day, moderate exercise, at least 3 times a week. All right. So that's typically the minimum. All right. So 30 minutes a day, 3 times a week. And you need to be doing some kind of at least mild exercise. You say, well, what does that mean? So if you're able to do whatever you consider this to be exercise, but still carry on a full conversation with your boys, that's not exercise, okay? And so you want to make sure that you're at least winded, breaking a little bit of a sweat, getting your heart pumping, all right? And that's really going to reduce your risk of colon cancer, all right? And so here's the big thing that we always hear when it talks about colon cancer. Colonoscopies, all right? So we say, what the heck is that? Colonoscopies is when they stick a camera. We actually can look up there and see, is there colon cancer there or not? The first thing someone tells me, nobody is sticking anything up my backside, all right? That's fine, all right? Because it's only one way, right? However, there's so many different ways to get tested for colon cancer. So you say, well, what are the different ways, right? We can actually have you just poop, right? And you give it to us, we do all the dirty work, okay? We can actually take your poop, which you would just flush down the toilet anyway, and actually run several different tests on your poop to actually let us know if there's cancer there or not, all right? So if you say, you know what, I don't want to, people to stick anything up there, that's fine, that's your prerogative, that's your choice. I will say that is the test of choice, because there's nothing like looking and just seeing, is there cancer there or not, right? Because that's a quick thing to do. But if you say, hey, that's not what I want to do, that's fine. Give us some of your poop. We'll go through it. We'll look and see if there's any cancer cells there. All right. And we'll take it that way.
All right.
All right. I wanted to briefly talk about lung cancer real quick, just because lung cancer, people think of that as a smoking person's disease. However, just know it's also a Black man disease. Okay. We die more. We actually have a higher chance of getting lung cancer. Are you noticing a theme with all these cancers? We're getting it earlier, we're getting it more, we're getting it at a more advanced stage, all right? And we're dying from this stuff, okay? They actually did a research study, and they said that Black people, Black men specifically, even when they smoked less cigarettes, still were more likely to get lung cancer. So don't say, oh, I just smoke, this is what I hear all the time. I only smoke when I drank. People say that all the time. You are increasing your lung cancer compared to somebody else who may smoke one pack a day, 2 packs a day. All right. So your less tobacco is still a risk factor for lung cancer if you're a Black man. Okay. Last thing I want to just bring up is that we do have a way for detecting lung cancer early. All right. You say, well, what is that called? It's a screening test. So they do what they call a CT scan or a CAT scan of your chest, and anybody who has smoked, so typically it's at least 1 pack of cigarettes for 30 years. You say, well, that's not me. I smoke 3 packs of cigarettes a day for 10 years. That's still the same. Okay. So we have a calculator that we can calculate, your risk of lung cancer. If you have ever smoked, then you need to talk to your doctor and tell them how much you smoked. Okay, and we could potentially give you one of these CT scans early, meaning that in your early 50s, to say, do you have lung cancer or not? All right, because once these cancers spread, gentlemen, ladies, if you can hear my voice, it is too late. Okay, so we need to do these what they call screening tests early. Okay, and yeah, that's pretty much what I want to talk to you guys about today. I think next slide is just I'm sure other folks will kind of talk about this, but what are the reasons why Black folks have these issues with prostate cancer, colon cancer, lung cancer? Genetics, we don't know. We need to research this kind of stuff, okay? So don't look at research as a bad thing, okay? A lot of it is like what we eating, and that has a whole kind of downstream approach about kind of access to foods and what we were able to do, what we can afford, what we call food deserts in our community. That's a whole nother discussion, but just know all that plays a part.
Exactly.
Tobacco use, viruses, stuff like HIV, hepatitis, some of those things are more common in our community. So those things lower your immune system and increase your chance of getting some of these cancers. us being scared and not going to the doctor is a big thing, right? And so, so hopefully people under the sound of my voice today can know that at the very least, it's important to get these things checked out.
Exactly, exactly. Thank you so much. Thank you so much. And I know we have some more questions that's going to be coming up towards the end. Let's jump to Dr. McPherson real quick. Dr. McPherson, not many African Americans go to a chiropractor. Can you explain why is it important for Black men to go to a chiropractor? I know you shared something with me yesterday that we talked as well, but can you share with us why is it important for Black men to go to a chiropractor?
Absolutely. And I love the way Dr. Blue put it. There are certain things that you can and can't control, but lifestyle is definitely one of those things that you can really make an impact on your day-to-day life and your long-term prognosis or outcome. And that's where I factor into the equation of healthcare. It's the lifestyle side of things. If you have smoked in the past, but you're trying to quit, or if you had an unhealthy diet or you're trying to improve on that, that's where I come in. Like I said earlier, I see our patients often, once a week, once a month, whereas Dr. Blue may not see them, but every checkup, and so I get to really screen the patients for some of those things they may mention to me, like, oh, I'm having back pain. People come to me for back pain, but that can mean many things. It could mean you slept that poorly on the couch, or it could mean you need to see a specialist like Dr. Henderson or Dr. Blue. And so in our practice, one thing that happened to me, I've been practicing 7 years, which is fairly new, but still long enough to see a few things. And I think it was, to me, a good day in practice and a bad day in practice. And, back pain, that he was mentioning certain things, and there are certain things with cancer, unexplained weight loss and certain things that you can kind of pick up on in your history and in your intake that you can kind of say, well, maybe we need to look into this a little bit more. And then this patient had lower back pain that just had a gut feeling. And we sent him out for some imaging and came back, and you can visually see on a scan when some of these things start to take hold and even metastasize or spread to a certain degree. And we were able to get that patient out to a specialist, and he's doing much better, and hopefully he's going to turn around and do quite well. But that's where I factor into this. I think we serve as a good portal of entry to some of these other specialists who can really do their job better, because we're able to spend the time with the patient and pick up on some of those things that the specialists or primary care doctors may not have time to screen for or to hear in a discussion that they need to.
So just for clarity, me coming to you, you could actually maybe not diagnose it, but say, hey, this is something we need to look into when it comes to prostate cancer. And then from there, because I think you made a great point, we are seeing you more frequently. We see you like once a month, honestly, as opposed to going to our specialists. And so it's kind of like everything's connected in a sense. Correct.
Yeah. And, it's a good thing. Like I said, we spend so much time with the patients, and, as men, especially in men's health, I know this section, I believe, is men's health. We tend to, like Dr. Blue said, we kind of minimize things and, oh, I'll push past it, or, oh, I'm just gonna, it'll get past. But there are certain things, like I said, the unexplained weight loss, some of your restroom habits at night, family history, things like for instance, we ask a patient, have you ever had surgery? They'll swear up and down and say no, and then as soon as you get into the exam, you see a big incision on their back. So just speaking to the patient regularly about certain things, where educational or from a screening perspective, that can unveil certain things that, again, can be beneficial to Dr. Blue or another specialist to actually treat the patients properly with advanced conditions that we can't treat. So there are a lot of studies and partnerships with chiropractic and like Cancer Centers of America and American Cancer Society. And it's not to treat cancer. Like chiropractors, we can't treat cancer, but we can help improve the quality of life when you are diagnosed with such diseases and disorders. So that's where we factor into the healthcare perspective, is really just making sure that we're having those conversations with patients to educate them and also pick up on certain things early enough to have an impact on them.
All right, perfect. All right, so we're going to come back to you. I know we got a few questions coming up. Let's go to now to Dr. Henderson Jackson, and she has a presentation as well. And again,
Hi,
this is interactive. Yes, we can. Yes.
Good. I want to make sure.
You're good to go.
So I'm going to run through some things we see from a pathology perspective. Next slide. So a lot of times, many people don't know what pathology is or who we actually are, but we are medical physicians, and we specialize in diagnosing the disease, like giving a name to it So your clinical team that you most likely know, your medical doctors that you see, hospitals or clinics, know how to treat you. In my lab, we look at your cells, your tissue, your biopsy, your blood, your lab work, and we give these accurate measurements or we give a diagnosis so your clinician can make the right healthcare decisions or treatment. And we are of utmost importance because 94% or more of lab tests basically account for a lot of what's done in patients. And we, as pathologists, are really run the lab. So we have to be informed and we have to get out a lot of information, making sure the right test is done at the right time and for the right patients. As you can see with COVID, testing and having labs and being able to make sure our tests are accurate are very important. Next slide. So when it comes to cancer, here, just to kind of show where your prostate gland is, if nobody knew where it was in the red circle. But I have a picture. What is the normal prostate? And then the bottom, you can see what is the abnormal prostate with the arrow pointing to the cancer, where this is what I do. I look at people's tissue or resections of tumors, but also know you may not always need a resection. You can get a biopsy. This is like a small little like needle-like thing that they can biopsy the tissue so we can make a diagnosis. And here, what I see under the slide on the very end are things in pink and purple, the little circles or dots that you may see, where I know these are cells and I can identify them as tumor. Next slide. Here is colon cancer. Colon is a big organ because it helps you digest everything. In there, I can have some examples of what your normal colon looks like versus when you have polyps, which can be identified with colonoscopy. And those can actually be resected and taken out at the time of the colonoscopy with the red arrow showing the polyp below. But then if you move across and nobody actually follows up with screening or can catch this early, it can grow into a cancer that can be very ugly, gross, almost looks like you have an oozing in the center and necrosis and things like that. And then besides that, you can see this would be like a picture or image of the tumor that I, the pathologist, can see, so I can make that diagnosis for your clinician. Next slide. Lung cancer, yes. We see that a lot as well. Your lungs supposed to be nice, aerated. You can see all your bronchioles, everything. But then on the image below, you can see that there is some type of irregular white lesion within the lung. And next to that, you'll see that pinkish, purplish picture with cells that I will look at on the microscope and be able to determine, okay, that's cancer, that's lung cancer. And as you can see, the majority of lung cancers are usually adenocarcinoma as a term that they describe versus squamous cell carcinoma, which is the next most common type of lung cancer. Depending on either one, we will be able to help the patient with molecular testing, so we know how to treat you, what chemotherapy drugs your clinician can use, if there's any availability, again, for clinical trial. Next slide.
So we do have a question just real quick.
Yeah.
If you can answer this question. So the pathologist provides a diagnosis, but a provider at a separate institute is tasked with developing a treatment or care plan. Do you think some of the disparities in survival rates are because of a disconnect in provider communication? I think that's two questions in one.
Okay. Well, yes, that does happen. When you may have one hospital that did a biopsy and then you have treatment at another place with another specialist, because again, insurances could be different and say you have to go here versus you have to go here to do this. As pathologists, we work hard to communicate with the clinical team. Even if my clinical team is not within this hospital, I have worked with other hospitals within this region and area and other clinicians. It just takes a phone call for us to speak with them concerning a pathology report. And that does not make a big deal for us. This is what we live for. We went into this field and we love working with our clinicians to make lives better for the community and the patients that are there. But it is a sore point because not every organization, hospital, whatever, may have that strong communication and connection with all the surrounding healthcare entities.
All right, thank you.
Can I answer that real quick too? I just wanted to say,
yes.
One main thing that I think you might be actually right about that I didn't even think about is that a lot of the patients that I see are for what they call second opinions, okay? So sometimes what happens is that an original cancer doctor or even the pathologist may have called something not cancerous. And then they come to Moffitt and we take a second look and we say, well, I know they told you you was cancer free or that you don't have cancer, but I'm here to tell you the real deal. And so I will say the amount of people who are able to either afford or that do come to see these second opinions, they typically don't look like me and you, you know? So I will say that, you know, if you're able to, if you have a loved one and someone's even suspecting cancer, please do a second opinion, okay? Because it could literally change your life, okay? Because there are numerous times when, you know, someone just didn't get it right, which is, we all, you know, missed the mark, you know what I mean? And so a second opinion gets someone with fresh eyes to look in and say, hey, is this really negative? So I do want to encourage people to do that.
Exactly, thank you.
Agree. So why is pathology important? Again, patients, you may be bombarded with a lot of information when you have your visits with your doctor, especially when you get that ominous diagnosis of cancer. A lot of things they be talking to you and you're probably not even digesting it all. That's okay. But you will have reports and pathology reports on what you have. I will mention it's important. The medical files that are there in the hospital, they are your files, okay? You can have copies of those files, read the pathology report. You have questions about your pathology, there is no problem with contacting the pathologist because the pathologist signing your case is always on your pathology report. There's a lab and we will communicate with you. If you want to talk about what's in my report, what does this mean? Because then we can give you more information. Sometimes when you just had a visit, you're going over some things, it wasn't quite clear with the clinician that you were speaking with about this or the nurse, and you want more clarification. We pathologists, we are here. I love speaking with patients because I do. I have even had patients come to the lab, my office, that wanted to see their slides of their biopsy or their tumor that was resected, and just showing them what their tumor looks like in comparison to what is normal changes their minds, like, you know what, maybe I should do this treatment that has been offered. Maybe because I showed this patient with breast cancer that this HER2 is strongly positive, they change their mind, like, you know what, maybe I should take the HER2 drug that would help me. That may change people's mind if they actually can see it and speak to the pathologist. Do not be afraid to ask questions. That's one thing. When you go back, don't be afraid to ask questions. Don't be afraid to wanting to speak to clinicians from all the different fields that are specialists are coming and talk to you if things need to be explained more or repeated or again. So why are reports important? Because off of that, we grade your tumors, we stage your tumors, trying to help them guide what is your outcome. Is it going to be poor or is it going to be okay, good? Treatment options, all these testing, you're trying to personalize the care that we provide to patients. So there are different testing and molecular testing, which again, if you don't see your clinician asking for things and you see things, I know people will Google, people see all the drug commercials. Ask, go and ask. Just don't rely on the Google and the commercials. I always tell patients, ask and speak with a clinician, and like Dr. Blue said, get a second opinion. Ask those clinicians, what would you do? What would be the guidelines for this? Again, effective treatment always begins with the right diagnosis, and that starts with pathology. And again, like you said, some people come for second opinions, some people don't. I recommend second opinions because there may be changes in stage or grade that can open opportunities for different clinical trials versus, okay, this was overcalled and this patient's going to have a better prognosis. So definitely recommend that as well. Next slide. That's it. Questions?
Yeah, and we do have a variety of questions coming in. We also have some pre-questions as well, so it's going to go to everybody. One of the first questions that we have is, how would you discuss and document any marijuana smoking in the aspect of lung cancer?
I'll take this one. So really, you want to be honest. People say this with two people in life. You want to be honest with God, because God already know. And number two is your doctor, okay? Because what I don't know could potentially kill you. You know what I mean? And so if you're taking some of these things, and just be honest about it, there hasn't been a strong association with marijuana smoking use and lung cancer. There's been other things like fungal infections, and some of those have been associated with marijuana use. So at this current time, it's specifically tobacco cigarettes that's had the strongest association with lung cancer. So at this point, just tell the doctor so the doctor knows, because there's certain medicines, unfortunately, that can change the ability that the medicine is what we call metabolized, or that the way the medicine works. So you got to let them know for that reason. But for lung cancer specifically, there hasn't been a strong association with it.
Okay, perfect. We do have another question for Dr. McPherson. Dr. McPherson, if you're just having regular back pains, is it necessary, or why is it necessary to go to a chiropractor if you're just having back pains, or what other things? I think the question is, what other things can happen with a chiropractor besides just back pain?
Yeah, so the first part there, one of the biggest things, like I said before, is when somebody comes in, we really have to do a thorough assessment of what's really going on. And for us, it's determining, what's the pain generated? What's the true cause of the pain? Is it the disc? Is it the facet? Is it muscle? What's the real issue? And so that's the primary reason why people come to see us, is lower back pain. I mean, I think the statistics are like 80% of Americans at this point suffer from low back pain at some point in their life. And so when you come to see a chiropractor, or at least a functional chiropractor, they should really be assessing you head to toe, because, we hear the cliche, everything is connected, but it really is. When you talk about the nervous system and what you're actually feeling as far as pain, or even just any sensation, that travels through the spinal nerves and the spinal cord and onto the brain. That's how you perceive the pain you're perceiving. So when you come to see me, it does involve a functional assessment, sometimes imaging, sometimes may even be blood work we send out for, just to kind of see what's going on. And as we address the joint health and the movement, whether it's the muscle movement or the joint movement, that can most times resolve the symptoms that you're experiencing. And as I said before, if there is a reason why it's not responding to care, then we need to get you on to the right provider to find out what's the true cause of what you're dealing with. So when you see a chiropractor, like I said, it's mostly for functional health, keeping the joints mobile, keeping them moving, keeping the pressure off the nerves, pressure off the discs, pressure off the joint capsules, and keeping the muscles and the fascia and all that moving smoothly. Usually will keep you functional and prolong the health and activity that you're looking or you're seeking, and avoid pain.
All right, perfect. Another question. How do you reduce racial disparities in healthcare? What can I, as a patient, do to reduce or confront the racism I face from those who I need to help heal me? And that can go to either one of you.
Ooh, that is a deep question. I think we all deal with it. I mean, I'm not always wearing my white coat. I mean, there's times when I don't, right? But I think the main thing you can do is be an advocate for yourself and speak up. That's one thing that we tend to not do. is kind of be very docile and, you know, kind of say, well, you know, the doctor said I didn't need it, so I didn't need it. Even though I heard Dr. Blue and Dr. Jackson and Dr. McPherson they told me I needed it, but the doctor said I didn't, you know, and just be like, you know, because a lot of times as doctors, like if they hear you say, hey, I want this test, which some populations come in the door saying, you need to do this, then most of the time they do it. You know what I mean? And so I think that, you know, just kind of knowing, and if you don't know yourself, because you know, that's one question you say, I don't know what questions to ask, or I don't know what things to do, you know. Most places have or cancers or diseases have what they call a patient advocate to kind of help you kind of navigate this whole thing, because it's confusing for everybody. So try your best to be your own advocate, but if not, you can always seek out what they call patient advocates, and they should be able to help you.
If I could add on a little bit more on my perspective, there is like Dr. Blue said, even asking more questions. Know that you're in charge. You know, you're hiring your doctor to treat you. You know, so if you don't feel like the doctor is really giving you a good, thorough evaluation and assessment, feel confident enough to either get a second opinion, see another provider, and really stand in the driver's seat. And if you don't feel confident and comfortable doing that yourself, hopefully, you know, you're comfortable enough with someone else that you can bring to your appointments with you to ask the right questions. Because I do see that happen, not often, fortunately, but in certain situations where people are going to a provider just because their insurance told them they had to go there, or their primary told them they had to go there, and that doctor may or may not be the best fit for you. So always make sure that you feel confident, comfortable knowing that you're actually hiring your doctor as well.
You know, that's another thing too. You brought up a good point. People always feel like they're not being loyal or that you're doing the doctor a favor. You need to do yourself a favor, all right? And really try to make sure you find the best fit. It's all right if you need to go to somebody else, all right? And we understand that. That is very common and expected, that you need to find the best fit. So don't feel like you're being disloyal or you making the doctor upset with you. No, go find who you need to find and take care of yourself.
All right. Another question from the audience. I'm a 51-year-old male. Should I be concerned if I find it difficult to urinate when I first wake up in the morning? I have the urge, but it just trickles out. After that first urination, I do not have any problems for the rest of the day. This happens about 3 or 4 mornings in a week. Recent PSA came back negative.
Yeah, so that's a very common thing that happens to most men kind of as they age. And so, you know, one thing that we talked about today was specifically prostate cancer, but just because the prostate could be just a little enlarged, you know, and I don't know if, you know, you guys remember that screen that Dr. Jackson kind of put up on her, her slides that showed you from the bladder, which is where all your urine sits, till it exits, you know, out your pee hole. There's a lot of things that can really kind of get in the way, you know what I mean? And so for sure, it's something that while it may or may not be related to cancer, it's something for sure that you probably need to get checked out, because for a lot of times when that is happening, there's medicines that we could actually put someone on to kind of help ease the flow of the urine. And so, so that's for sure a very common issue. It's not something to be embarrassed about. And we actually have medicines to likely treat that. So I would for sure bring it up, and hopefully you can get it checked out.
All right. Another question. If my penis was straight, but now it's curved, is that a problem?
Yeah, so sometimes that does happen, right? So again, I don't know if we remember the anatomy from the picture that Dr. Jackson put up, but basically, you know, all the, you know, the penis is, you know, tissues that kind of basically engulf with blood to kind of stay erect, and sometimes, you know, with lack of blood, you know, goes flaccid again. And so over time, sometimes those tissues, like all the tissues in our body, we kind of lose the tension, the straightness, you know, we get a little saggy, and, you know, things aren't the same as they used to be. And so sometimes that does mean that the penis sometimes may take a turn or so, because the tightness of that, if you guys can relate to that, just gets a little looser. Just, you know, just like with wear and tear, just like anything in life, things aren't as they used to be. And that's definitely happens sometimes.
All right. I'm 33. Will my doctor screen me for colon cancer if I request it? No family history.
So typically 33 is a little young. And so if you don't have any family history, that's different than you don't know your family history. Does that make sense, the difference? So, you know, some of the people say, oh, I was adopted, or, you know, they just don't know the family, you know, life happens, right? It was raised by somebody who wasn't really, you know, related to them, and so they don't know. But if you already know and there's not a family history, then the chances are they probably would want to wait probably at least another 10 years to kind of have those conversations, unless you're having symptoms, meaning that, like, if you're saying, hey, I'm noticing blood in my stool, or hey, I'm noticing I'm going to the bathroom having, you know, frequent bowel movements, and they, instead of them looking like a normal, you know, poop would look, they look a little funny to me. You know, or if there's some symptom that's happening or some reason, for sure they'll do it, and it happens all the time, because as you see, Chadwick Boseman was only 39, I believe, or 40 when, you know, so it does happen. But typically you got to have some type of symptom and say something's not right back there. So what does that mean? Next time you go to the bathroom, instead of just flushing, take a look back there. Make sure your stuff look okay. You know, people be afraid to look back there, but you need to make sure that what you're seeing is really the way it should be.
All right, perfect. Another question. If I have been diagnosed with cancer and want to see a specialist at Moffitt, is there a waiting list?
Yeah, so I tell all people that if you have a diagnosis of cancer, Moffitt would love to see you, especially if you're Black. All right, because we've been trying to raise the alarm and let people know that we are open to see everybody. Okay, and we love to see Black folks. Okay, because we don't see enough of them here at Moffitt, just to be honest with you. And it's doctors like me, Dr. Jackson, that are here at Moffitt wanting everyone to come. Okay, so if you are hearing the sound of my voice, do 813-745-3980. You call that number, you say, hey, I got this cancer, we will get you in. All right. We actually have a thing now. We're trying to get you in within the first week or two. So if you got it, come in. We will help you. 813-745-3980. Come to Moffitt, and we will for sure take care of you.
And Dr. Henderson, were you going to jump in? Dr. Henderson Jackson, did you want to jump in on that as well?
Definitely. If you think you have cancer, diagnosed with cancer, please reach out to Moffitt. We have patient nurse navigators.
I think we lost your audio.
Yeah, one thing I think she was probably trying to say is that what we do at Moffitt, even if you don't have cancer and you think you got cancer, or you want to be screened for cancer, we would help you. A lot of times we even do it sometimes for free. So for example, like if you're a woman and you're hearing this, what they call mammograms to check for breast cancer, we do that here at Moffitt. So you don't even have to have cancer. Those colonoscopies and those poop tests that I was telling you about, we do those here at Moffitt, okay? The prostate stuff, we do those here at Moffitt. So even if you don't have cancer, okay, we will help you, okay? Because that's our world, is to not only help cure cancer, but prevent it, all right? So 813-745-3980, come see us.
All right, perfect. And Dr. Blue, if you don't mind, if you can type that into the chat as well, that'd be perfect as well for those individuals to get that number and that information as well. We have a few more minutes. We have about 2 more minutes actually, so we're going to give you all the last closing statements. If you all can just tell us, why is it important? Why is it important for African American men to get tested? Whether it's for cancer or even just coming to a chiropractor. Why is it important for African American men to get to a chiropractor? So we're going to close it out with just some great advice.
I'll go first here. So it's very important, as I kind of led to before. I think we kind of tend to minimize things, and just as with your car, just as with your home, it's always better to be preventive, more preventative than fix things after they become an issue. And the sooner you can bring some of these things to light, if they are going to be part of your life journey, the quicker and sooner that Dr. Blue, Dr. Henderson, myself, and other practitioners can help you, So I think we owe it to ourselves and our families to be proactive in many ways. And definitely when it comes to your health, this is serious business, and to get over, that discomfort or uncomfortability that you may have. I mean, we're here to help you. Don't feel that there's a barrier here, and there are providers in your community that are willing to help you. testing. And just a reminder, as Dr. Blue also said, you're in the driver's seat. If you're not comfortable with your provider, seek the opinion of another.
Exactly.
Great.
Any other closing? All right.
My closing remarks are just say, listen, guys, cancer's real. It's taking out Black men. This is the men's forum, higher than everybody else. All right. So when you see cancer commercials and that kind of stuff, that really means that it's attacking you more. You need whatever drug they're advertising more than anybody else, even if you're not represented in the commercials. All right. So you need to be on top of it. Come see us. If you love your son, your grandson, if you love your daddy, your uncle, even if they're not here watching this, you tell them, say, hey, this is a problem and it's killing us. And you need to come see us. And if you don't come to Moffitt, it don't matter. See somebody. All right. Because that's really what we're trying to do, is help our people live long lives and really try to tackle this thing. Because, if not now, then when?
Exactly.
Right? Let's do it.
Exactly.
Yeah.
Dr. Henderson, go ahead.
Just really, it's important for the Black community, for our families, that you get the health care you deserve, okay? You deserve the health care. Go to the hospital. Take time off of work. I constantly get somebody, oh, I gotta work, I can't take enough time. Make time, because at the end, you're gonna lose so much time. Take the time now so you can cherish all that time with your family, with your friends, and join the things you love to do. So seek the health care, and if you don't like that doctor, find another doctor, okay? You need to get the health care you deserve.
Great conversation, great advice. Definitely, I know these individuals will be around. If you want to reach out to them and just ask personal questions, I know they'll definitely be willing to answer those questions for you. We are grateful for this panel discussion, and we will be looking forward to you all, to the audience, join us for the rest of the week. We have 2 more days, Thursday and Friday, of our USF Black Alumni and Moffitt Cancer Center partnership. But again, as African-American men, as you've heard all before, get tested early, put the egos to the side, put the pride to the side, because we want you to be here long enough to be here for your family and friends so they can enjoy every moment of you. So again, USF Black Alumni Society, on behalf of USF Black Alumni Society and Moffitt Cancer Center, we thank you all for joining us today, and we hope to see you all back again tomorrow at 12:30.